Jacobs of Loomis Basin Equine Medical Center, and today we're going to take a couple minutes and talk about the condition known as scratches in horses. It's winter time, so it is an issue that we do see a fair bit in the more wet conditions, so I thought this would be a good time to talk about it. So here's a picture of what scratches can look like in your horse. This is a close-up of the back of the pastern, or the lower part of the limb right above the hoof. And you can see there's some scabbing there, and this is a really typical way that scratches will appear, with a bunch of scratching and some discharge from the skin. So some other terms, in the equestrian world, a lot of times there will be other terms for conditions. So it can also be known as mud fever, dew poisoning, and greasy heel, also known sometimes as pastern dermatitis. So common causes of scratches, they can be viral, bacterial, it can be a fungal or a parasite condition. And any of those can enter into compromised skin in that lower limb area. So signs you'd be looking for to know if you had a horse that had scratches would be swelling, redness, any oozing, some yellow discharge, crusting or matted hair in that area. And then in a more advanced case, you can get some pain and even some lameness associated with scratches. And it can also be on different parts of the limb. It doesn't have to be just defined in the pastern. It can be up the limb, up the cannon bones as well. So what horses are at risk? Any horse that's living in wet conditions, muddy conditions, draft horses specifically, because of the feathers on the back of their limbs, are more prone, because those areas are, have a harder time drying with all the feathers, all that extra hair. And then we also tend to see horses with light pigmented skin. Horses with white socks seem to be more affected than horses with black or brown limbs. So diagnosis, a lot of times we'll just diagnose this based on the clinical signs, but if we're unsure, sometimes we'll do a skin scraping or a biopsy. And then treatment for the condition starts with clipping the hair, and then cleaning the area with an antibacterial soap, something like betadine solution, making sure the skin is really dry before putting on any topical medications. And the topical medications, you want to ask your veterinarian, are based a lot of times on what we think the condition is caused by. Sometimes we'll use an antibacterial cream, a steroid cream, sometimes an antiparasitic cream. And then occasionally we do have to put horses on systemic medications, antibiotics, depending on how significant the infection is. And then another really important piece of it is keeping the horse dry. So if they're living out in the mud or in a really wet pasture, a lot of times they'll need to be stabled in a dry stall with good shavings, good bedding, until the condition is resolved. If you have any questions, or you think your horse may be suffering from scratches or some condition like this, you can give us a call at Loomis Basin, 916-652-7645, and we'd be happy to help.